Have you ever looked at your feet and thought, something's different, but I can't put my finger on it? After 50, the feet often whisper the first clues about what's happening inside the body, long before bigger problems appear. Tonight, let's sit down together, take a calm look, and learn the secret information your feet might be trying to share. I'll guide you through 7 careful checks, practical at-home steps, quick mini-tests, and clear moments when it's wise to call your clinician. Keep a pen handy. You may want to jot a note for your next visit. Cold, pale, or blue toes. A circulation clue why this happens. In plain English form, rosy toes usually mean blood is flowing well. Pale, bluish, or persistently cold toes can signal that blood is having a harder time reaching the surface. Story: Arthur, 72, from Devon, noticed his toes turned slightly blue after long stretches of sitting. He set a timer for hourly circulation breaks. 20 ankle circles each side, 10 calf raises at the counter, and a 5-minute stroll to refill his tea. His toes looked pinker in 2 weeks, and his afternoon energy lifted. At-home check. Compare feet side by side, color, warmth, and capillary refill. Press a big toenail until it blanches. Color should return within 2 seconds. Do now. Move for 2 minutes every hour. Keep legs uncrossed. Elevate feet for 10 minutes mid-afternoon. Wear soft, non-binding socks and shoes with a wide toe box. Add a 10-minute walk after meals to wake up the calf pump. Call your clinician if the color change is new. One foot looks different from the other. The toes turn blue or pale with pain, or you get calf/foot pain when walking, which eases when you stop. Sudden swelling. When your ankles speak up why this happens. Fluid can pool around the ankles with salter meals, long sitting, certain meds, or circulation strain. Story: Margaret, 69, from Yorkshire, spotted deep sock marks by evening. New for her. A nurse reviewed medication, sodium, and routine. Lighter evening meals, a short after-dinner walk, earlier bedtime, and feet propped on a cushion, while reading brought the puffiness down within a week. At-home check. Press your thumb on your shin for 3 seconds. If a dent remains, note it. Compare morning versus evening. Do now. Mini pumps during TV. Point and flex feet 30 times for commercial break. Keep water handy. Swap tight cuff for non-binding socks. Sprinkle herbs instead of extra salt. Try 2 5-minute after meal strolls. Call your clinician if swelling is sudden, one-sided, paired with shortness of breath or chest discomfort, follows a long flight or car ride, or persists beyond a few days of self-care. Tingling, burning, or numbness. A nerve message why this happens. Nerves don't like pressure, high sugars, certain meds, or long periods in the same position. They complain of pins and needles, burning, or numb spots. Story: Tom, 66, from Ohio, felt sand in my socks at night. He adopted a routine: warm rinse, careful drying between toes, a thin layer of plain moisturizer on tops and bottoms, not between toes, seamless socks, and a 20-minute dusk walk. He mentioned it at his checkup. Blood sugar and B vitamins were reviewed. 1 month later, burning eased and sleep improved. At-home check. Gently tap each toe in the ball/heel. Notice any dullness or zings. Compare left to right. Do now. Steady your blood sugar with protein-first meals. Limit tight shoes. Vary sitting positions. Prioritize gentle daily walking. Call your clinician if numbness is new or rising the foot, you're tripping more, weakness appears, or pain disrupts sleep. Early attention protects balance in skin. Skin and nails. Stories on the surface this happens because skin and nails reflect pressure, moisture, and tiny infections, often fixable when caught early. Common clues: dry, cracked heels, pressure/dryness, thick yellow nails, often fungal, spoon-shaped nails, possible low iron, shiny hairless shins, reduced flow. Story: Nora, 71, from Melbourne, swapped narrow shoes for a wide toe box and added a weekly spa minute. Warm soak, gentle callus file, moisturizer, nails trimmed straight across. Her heels softened, walking felt easier. At-home check. After a shower, look for calluses, cracks, color streaks in nails, and hot spots. Do now. Moisturize tops and bottoms, skip between toes. Rotate shoes so each pair dries fully. Change socks daily. Consider breathable cotton/wool blends. Trim nails straight across. Avoid digging at corners. Call your clinician or podiatrist if Nails are thick and painful, new dark streaks appear, skin splits won't close, or, especially if you have diabetes, there's any redness, warmth, or drainage. Sharp toe or morning heel pain. The pain map why this happens. Specific structures complain in particular places. Big toe joint, gout, or wear. Heel, plantar fascia. Ball foot, nerve irritation. Side of big toe, bunion pressure. Story. Lila, 75, from Portland, woke with a knife in the heel for her first steps. A towel calf stretch in bed, 20 seconds, 3 times. Tennis ball arch roll, and swap into cushioned shoes with firm heel counter, reduce her morning pain within 10 days. At-home check. Press where it hurts. Heel edge versus center. Big toe joint between the toes. Notice what worsens at first steps, long-standing tight shoes. Do now. For heel strain, towel stretch before standing. Arch roll 1 minute. Gentle calf stretch at the wall. For bunion ache, wide, soft uppers, no pointed toes, optional toe spacer home. Call your clinician if toe pain is sudden and severe, a joint is hot and red, pain wakes you at night, or pain makes you avoid your usual walks. Cuts that don't heal. Time is a test. This happens when blood flow or nerve feeling is reduced. Minor injuries linger, sometimes unnoticed. Story. Daniel, 74, from Seattle, had a tiny heel crack that wouldn't close. A clinician gently removed hard edges, applied a protective dressing, reviewed sugars and circulation, and emphasized moisturizers. It healed, and he learned how to protect his heels before dry weather returned. At-home check. Use a hand mirror for the soles. Look under the toes and at the heels. Do now. Clean, pat dry. Light moisturizer around, not into a wound. Protect with simple dressing. Change daily. Wear shoes indoors if floors are rough. Call your clinician promptly if redness spreads, warmth or drainage appears, feverish feelings develop, or if you have diabetes. Any open areas present. Balance. Gait and arch changes. Your independence indicator why this happens. Arches tire, ankles stiffen and hips weaken. Tiny shifts that change step length and stability. Story. Evelyn, 78, from Brisbane, noticed she reached for hallway furniture. Her physio taught a simple trio. After 3 weeks, she felt steadier and walked farther at the market. Daily trio. 10 calf raises, holding the counter. 10 slow sit-to-stands from a sturdy chair. 30 seconds of single leg balance on each side, hands hovering over the counter. Plus, heel-to-toe walk along a hallway line, ankle circles while the kettle boils. Shoes. Firm heel cup, cushion midsole, and the thumbs with the space beyond the longest toe. Call your clinician if you're falling, feel sudden weakness, or have new dizziness. Those are red flags. 5 at-home mini tests, 2 minutes, big clues. Toe press refill. Press a toenail until it blanches. Color should return in less than or equal to 2 seconds. Tissue tickle. Eyes closed. Touch each toe with a twisted tissue. Dull spots suggest sensory change. Stand and sway. Feet together near a counter. Notice excess sway. Balance nudge. Heel raise count. Single leg heel raises with fingertips on the counter. Fewer than 5 suggest calf weakness. Step length scan. In a hallway mirror, compare step length. Shorter on one side can hint at guarding. Your 60-second home foot check every evening. A look, color, swelling, new marks, nail changes. Feel, warm/cool areas, tender spots, numb patches. Move. Wiggle toes, ankle circles, rise on toes 5 times. Note, write one change to mention at your next visit. Smart shoe fit checklist, 3 quick rules. Room for toes, a thumb's width at the front. Toes can splay. Stable heel. Firm heel counter. Heel doesn't slip. Flexible front, supportive middle. Bend at the ball of the foot. Mid-foot stays supportive. Bonus. Try shoes late afternoon when feet are slightly larger. Bring your usual sock/orthotics. Walk on a hard surface for 2 minutes. Sock sense, small fabric, big difference. Choose non-binding cuffs to avoid deep marks. Pick breathable fibers and change daily. Rotate pairs. Let shoes dry 24 hours. If skin is fragile, seamless socks reduce rubbing. Hydration, heat, and night cramps. A quiet trio. Mild dehydration can tighten calf muscles. Sip water evenly through the day. In hot weather, elevate feet briefly after outdoor time. For night cramps, stretch calves before bed and keep toes neutral. Avoid pointed toe sleeping. A gentle foot care ritual you can start tonight. Warm rinse. Pat dry, especially between toes. Moisturize tops and bottoms. Skip between toes. Inspect with mirror, color, temperature, cuts, nails. Slip on soft, seamless socks. Let shoes dry thoroughly overnight. Jot any changes to share at your next visit. These 5 minutes protect comfort, confidence, and independence. Your calm 7-day foot reset day 1. Replace tight socks with non-binding ones. Day 2. Add the Daily Balance Trio. Day 3. Swap narrow shoe for wide toe box, supportive shoes. Day 4. Practice the 60-second check before bed. Day 5. Take 2 5-minute circulation walks after meals. Day 6. Trim nails straight across. Moisturize heels. Day 7. List changes and 1 question for your clinician. Red flag moments. Please don't wait. A foot suddenly turns pale, blue, or cold, especially with pain. A hot, red, swollen joint with fever or chills. A cut that won't close or shows spreading redness. New numbness with weakness or frequent tripping. Sudden trouble walking or unexplained falls. These are, today, not someday moments for medical care. Foot myths gently debunked. Foot pain is just age. No, most common pains have simple fixes. If I can still walk, it's fine. Minor problems grow. Early care's easier. Thick nails are normal. Common, yes, normal, no, and often treatable. Good shoes must be pricey. Fit and support matter more than brand. Healthy feet support market strolls, garden mornings, and grandkid adventures. Take a breath and look down. What's one small kindness your feet ask for? Softer socks, wider shoes 2 minutes, or a checkup you postponed. Write it down and begin tonight. Share your experience in the comments. Which clue surprised you most? What tip will you try first? The Daily Trio, the shoe checklist, or the 60-second check? If this helped, please tap like, subscribe, and share with a friend or family member who wants steadier steps and stronger days. Your story could be the nudge someone needs to care for their feet and protect their future.